with community eye care.
A very good morning to all. Not everybody gets the privilege of doing community work along with their private practice. And here I'm going to just give a little presentation of how we are doing it and what exactly drives one to do something like this. Because every time you talk about this and people want to know why should you be doing so much of charitable work and is it beneficial or not. So basically, whenever we are practicing, we need to keep a little bit of a balance, like that's what we are trying to do, and that is between your private practice and your community work. And why is that so? That's because we have two reflections in our purpose. And as medical doctors, as people who are there to do work for the people who come to us, we must have a passion, and the passion is for your work, for your profession. And with additionally in our profession, what is also available and what is with us is the compassion part. So just to nurture the compassion part, because if you are only in a private practice, then you cannot do work for just everybody and people who are also under, you're not going to be paying and all that, because so many dimensions come into the whole thing. But we, and in the line of working, we just lose this compassion. So just to keep this passion and compassion balance, I think it's very important to also have work doing in the community. And as professionals, we have our clinical approach, and also there is the public health approach. So, which is very different, because in a public health approach, we need to also cover aspects of prevention, because that's what we don't do when we are doing our clinical. We just do and we treat a disease. So there it is. And what is the bottom line is that we have to keep the balance of profit and not for profit. Because if we can do that, then we can make our work more sustainable. And that is the way to go about it. How do they complement each other? Because that's what we must know. Because only if we understand how they would be complementing, that we'll take this step forward and try and get community work also going along with our private work. Community eye health complements clinical ophthalmology knowledge. The diaspora of various diseases and of various ailments which you see in the community as a community ophthalmologist is far, far wide as compared to what you will see in your private practice. These cases are more challenging to handle, and they always enhance your ability to do more surgically as well as clinically also. So it's very important to have this balance of a community ophthalmologist work as well. And ophthalmologists are clinically trained to diagnose and treat disease. The concept of disease prevention at the patient level and to a greater extent at the population level is what you do when you are doing work in the community, and you also are pursuing your Vision 2020 objectives. Community high health, if you are into this community work, you also go through these epidemiological research, eye health promotion. So this is more on a prevention level as well. It's just not crunching numbers, but you're interacting with the population. You're seeing what exactly is the prevalence of the disease and how you're going to be encountering or preventing this disease. And how does it help us as professionals? This helps you in identifying the main cause of blindness and low vision in your own community, which is very important, and implement appropriate strategies to reduce barriers to eye services, provide equitable services for prevention and therapy. Now, all this vision comes with the place you have trained, because that is really very important, because those are your formative years, and a good residency program in an institute which is going to give you this direction is very important, because when you are working in places like Arvind Hospital, LB Prasad, you get this kind of a vision which drives you towards community ophthalmology whenever you're doing your fellowship, or even if you go for an observership program, and not just ophthalmology in the clinical sense. What is it that you do more as in your community ophthalmology practice? You are going for more eye care camps, which are in villages, schools. There's no difference in services offered to the paid and the free section. That is the bottom line of how you're going to have more and more people coming in your community section as well. Value inculcated during the training is what creates that vision. Now, what are the pros and cons? Why should you be doing this? The pros are there's never a day without an interesting case. And end of the day, there is satisfaction. Fulfill your passion with compassion and reaching the people who you actually cannot reach to, reaching the unreached. And from a marketing head to a maid, everybody you can treat under that same banner, and everyone goes back happy. And what are the cons? The fear that the paying patient won't avail your services. Actually, that's not that happens. It's just the opposite, because when people who are coming, even in your paid section, realize your vision, they understand why you're doing it, they become partners. We've had a lot of people who've come and they've actually become volunteers in the way we are holding camps and all that. This is our hospital, and we have a cross-subsidy model where 70% of our work is for the outreach and the balance 30% is for the paid, which helps to cross-subsidize these underprivileged. And these are few pictures of how we go into villages. And what we studied is that what we've seen is that in our villages, we see more women who are coming to the eye camps as compared to the men. So really it's empowering them as well. And the objectives are always awareness building and patient sensitization, our pre-campaign, campaigning, training of the local volunteers, conducting comprehensive eye care, giving glasses and medicines, and referrals and surgeries are brought to the base hospital. And what is very important is the education and the prevention aspect. So we've adopted 68 villages around our hospital. And our very strong work is also in school screening program. We've reached out up to almost 45,000 students, and the training of teachers, conducting pediatric eye care camps, and glass distribution. And with those who are have any problems with amblyopia or others, squints, they are then referred back and imparting education to these children. So these are the government schools which we have undertaken. And the schools covered have been 98 till date, and we almost now, I think we just upgraded, so almost 45,000 children, because every day we are doing a school screening whenever the schools are open, and every child is given 2 pairs of glasses of their choice. I think that is very important, and we go back 6 months later to see whether the children are doing well or they're following up or not. So we're also covering a primary health centers in Gurgaon. And we also are doing a lot of ROP screening program, where the team of the vitreoretinal specialists go into the civil hospital and the NICUs and do their work. So the only thing worse than being blind is having sight but no vision. Thank you so much.